There's a lot of potential benefits to being in an MDS clinical trial, and I think we have to approach it from a lot of different perspectives. I think one of the benefits is the opportunity for hope and to have access to a therapy that a patient would not regularly be able to receive because they're not approved in the United States or outside of the United States by the EU or other regulatory authorities. Sometimes a potential benefit is added observation or monitoring, perhaps engagement at an academic center. There's really just the opportunity for contributing to the field, understanding the safety or the mechanism or the biology of the new drug. And then, if a standard of care set of treatments for a patient has not met that individual goals, then I think it's really possible that a different outcome could be achieved if the drug was effective for the individual patient. Obviously, all of these things do come with advantages or disadvantages, which can be construed as risk, especially in the medical care setting. So, one set of reasons people don't participate in clinical trials is specifically the concern about risk of a drug or an intervention that has not been previously tested either in human beings if it's a phase 1 or has not demonstrated the ability to effectively treat MDS in a way that is positive to a human being. All drugs can have side effects. That's true of all medicines, even Tylenol or aspirin or blood pressure medicines. And so those are the risks that patients are often most concerned about and usually consented to in the clinical trial, which we'll talk more about later. I think the last risk is increased healthcare interactions, probably outside of a patient's primary MDS community center, which might be closer geographically to their home. Because as I have alluded to in prior segments, clinical trials are offered at the institution where they are open. And so sometimes that comes with a closer tie to a center that may be further away from an individual's home.